Good evening and welcome to Understanding Tinnitus, an Introductory Workshop. I'm Michele DiStefano, Director of the Shelley and Stephen Einhorn Audiology Center and the Berelson Hearing and Technology Center at the Center for Hearing and Communication. We're a state-of-the-art nonprofit center with 4 clinical departments consisting of audiology, speech and language pathology, education, and emotional health and wellness. We help people of all degrees of hearing loss and all ages. In audiology, we have expertise in diagnostic hearing tests, hearing aid and assistive listening devices evaluations and fittings, auditory processing and tinnitus, to name a few. Please remember to enter your questions in the Q&A throughout the webinar. There is time set aside at the end to address all of your questions. If you have any concerns that are not addressed in today's webinar, you can always contact us through our website. I'm now excited to introduce you to our speaker for this evening. Dr. Dominique Calandrillo is an audiologist and tinnitus expert here at CHC. Dr. Callandrillo provides comprehensive audiologic care to adult and pediatric populations. She specializes in tinnitus management, hearing aid and bone-anchored device evaluations and fittings, electrophysiological testing, and oral rehabilitation. She is also part of CHC's outreach team, providing hearing screenings and follow-up to preschool children in the New York City area. Dr. Callandrillo is certified with the Jastroboff Hearing Disorders Foundation in tinnitus retraining therapy, a clinically proven approach for managing bothersome tinnitus, and is working to develop a pediatric tinnitus program at CHC. In addition to her role clinically, Dr. Callandrillo collaborates in research with her alma mater, Gallaudet University, has served as an adjunct professor at Queens College, and is published in several academic journals, including the Laryngoscope and the Cleft Palate Craniofacial Journal. This coming fall, she will also be presenting at the Coalition for Global Hearing Health meeting. Dr. Callandrillo enjoys helping clients understand and advocate for their hearing health and is passionate about helping individuals better understand and manage their tinnitus. Most recently, Dr. Callandrillo has been trained in the linear system. Please join me in welcoming Dr. Dominique Calandrillo for this evening's event.
Thank you, Michele, for that wonderful introduction. Today, we are going to be speaking about understanding tinnitus. And let me share those slides. So what we will focus on today is what is tinnitus. So we'll be describing some definitions of tinnitus and how it may be perceived. We will look at the impact of tinnitus. We will talk about the mechanisms of how tinnitus can occur within the auditory system, as well as some management strategies in order to make dealing with tinnitus a little bit easier. We will then end with a question and answer. So if there's any questions during the presentation, please feel free to write your questions in the Q&A box. So let's begin with what is tinnitus. Tinnitus is the perception of sound in the absence of an outside acoustic stimulus. And so what this means is that tinnitus is perceived by the person that is experiencing it. It is a subjective experience. There are some rare cases where tinnitus can be objective, meaning that it is perceived by both the person experiencing it as well as the examiner. But for the most part, it is solely heard by the experiencer alone. It tends to have a loudness or volume to it, a quality, so the type of sound can be different, as well as a pitch. It's mostly present in conjunction with hearing loss. So 80 to 90% of the time, tinnitus and hearing loss will go hand in hand. But in 8 to 10% of cases, it can also be present in those without hearing loss. Tinnitus may be perceived as constant, so every day, always there, or intermittent, meaning it might be noticeable at certain portions of the day in certain situations. It may be present in one ear only or both ears. Sometimes it's even perceived in the middle of the head. And it can range in terms of many different types of sounds, like a humming, a pitched, a buzzing, a pulsing, or even other sounds. We have a poll that we're going to share, so you'll see that pop up, and it has a list of different types of sounds. So I want you, if you can, to answer that poll. There are multiple options that you can choose from, so you don't have to choose just one. But just to get an idea of what tinnitus may sound like for you. So we'll give it a minute or two here to get some responses in. Okay. So I'm seeing high-pitched tone for about 70%, buzzing 41%. And so this is just a good, idea, an example of how the quality, loudness, pitch of tinnitus can vary. We can't talk about tinnitus without touching on something called decreased sound tolerance, or DST. Decreased sound tolerance is an intolerance or avoidance of sound, and we use this term as really an umbrella term. Decreased sound tolerance can coexist with tinnitus, or it can also be in isolation, and it can vary in severity. Under this umbrella term of decreased sound tolerance, we have something called hyperacusis, which is a reduced tolerance to everyday sounds. And hyperacusis is really described based on the reaction. So that reaction to everyday sounds can be a couple of different things. It can be a loudness, meaning that everyday sounds are perceived extremely loud. It can be an annoyance or being bothered by those everyday sounds. It can be fear, and sometimes it can even be pain or a physical body experience. If you look at the chart on the right-hand side of the screen, you'll see this gives us the prevalence of these 4 different types of hyperacusis, where loudness is the most common. It's important to note that if you do have a hearing loss, there is a side effect of hearing loss that is called recruitment, meaning that there's an increased sensitivity to louder sounds. This recruitment is separate from the experience of hyperacusis. Additionally, misophonia is a strong dislike of certain sounds. So these sounds, in this case, may be loud or they may be soft. They may be also from a specific person or a specific thing. So for example, it might be chewing, a specific person talking, dishes clanking, for example. Decreased sound tolerance will range from about 0.2% to 17% of the population. And it can be in one ear, but primarily we see the experience happening in both. About 50 million adults in the United States will report tinnitus. And approximately 40% of those with tinnitus also have some degree of decreased sound tolerance, with about 27% requiring specific treatment for hyperacusis. You'll see in this pie chart here that about 36 million have non-bothersome tinnitus. It's not on their mind. It's not affecting their day-to-day. About 12 million or 24% will have bothersome tinnitus and seek help. They may reach out to a clinic, a physician, but they are talking to others to get information. And about 4% or 2 million have extremely bothersome tinnitus that significantly impacts their day-to-day life. This is more of a catastrophic tinnitus. Some risk factors may include age, where we see as we get older, that risk of tinnitus may increase. Lifestyle, substance use, caffeine, alcohol, nicotine, all of those may have an effect on tinnitus by changing blood pressure and blood flow. If you're a person that goes to a lot of concerts, is at a lot of events, or participates in recreational, noisy situations, that may increase risk as well. We see that tinnitus is a major service-related disability for our military personnel. Lastly, some medications may increase prevalence as well. For example, antibiotics that treat bacterial infections, such as erythromycin, and other ototoxic or ear toxic medications can have an effect. Here are some comorbidities. I'm not going to read through all of them, but a lot of these have similar reasons for increasing tinnitus perception. Mainly, it's changes within blood flow in the system. Mental health is important to note, depression, anxiety, stress. All of those changes within the body can impact the perception or increase the perception of tinnitus. Wax impaction, so if you have a buildup of wax in your ears, that can cause tinnitus to increase as well. The good news is that when you get that wax taken out, typically that tinnitus will subside. So what is the impact of bothersome tinnitus? This may change sleep habits, where falling asleep or staying asleep may become difficult. Increase stress, increased frustration. It may cause one to be frequently distracted, have difficulty communicating or participating in events, social activities. Difficulty focusing. This includes chores, work, and recreational activities. Let's look at some mechanisms of tinnitus and decreased sound tolerance and how it can occur. There are various theories of how tinnitus comes to be, and many are focused on issues relating to abnormal processing within the auditory system. You'll see on the right side of the slides that there is a picture of the structure of the ear. And we have our outer ear starting on the left-hand side, our ear canal with our eardrum. And then as we get to our inner ear, we see this snail-like figure. This is called the cochlea. And so this is really the organ of hearing. On the bottom, you'll see that that cochlea is zoomed in a little bit. And within the cochlea, there are these hair cells that are fine-tuned to the different pitches that we hear. Structural changes within the cochlea can change that perception of tinnitus. It can also lead to hearing loss, which is why we tend to see hearing loss and tinnitus go hand in hand. Another theory is that there is abnormal firing of neurons within the central auditory system. This increased firing or increased gain can lead to the perception of tinnitus. The auditory system tends to fill in missing information that is coming from the cochlea. And it may try to make sense of it, but it doesn't have all the pieces of the puzzle. And so the brain tries to compensate for that information, increasing all of that stimulus within the system, ultimately creating tinnitus. There's also some theories in regards to activation of the somatosensory system. This system is a system that is responsible for touch, for pain, and for movement. All of these mechanisms may explain why tinnitus is present, but it doesn't explain why tinnitus is bothersome for some and not others. So now let's look at the mechanisms of problematic tinnitus and decreased sound tolerance. We now know how tinnitus comes to be, an auditory perception, meaning that tinnitus is heard. So once tinnitus is heard or identified by the brain and becomes into a conscious level, the brain may identify the tinnitus as a threat or something to focus on. When that happens, some non-auditory systems can also get involved. This includes the limbic system, which is our emotional system, and our autonomic nervous system, which contributes to the fight or flight response. And so when these systems get involved, we get a cycle where tinnitus is heard, it becomes bothersome, it becomes focused on, and an annoyance factor becomes present. So how do we assess for tinnitus? The first step is to do a comprehensive audiologic evaluation. We may refer for a medical evaluation by an ear, nose, and throat physician. Imaging may also be recommended of the ear and brain structures. As an audiologist, we also complete tinnitus evaluations, which include completing questionnaires, matching the loudness of tinnitus, matching the pitch and the quality, and assessing loudness discomfort levels, or how loud sound can be before it becomes uncomfortable. So how do we deal with tinnitus? If you have a hearing loss, amplification may be a good start. In some cases, amplification alone can lessen the perception of tinnitus. The use of sound enrichment, such as physical sound machines or devices, or apps on your phone, can be beneficial as to having sound in the background. When tinnitus is present, quiet is not a good place to be. So we want to make sure that you have nice sound enrichment of positive or neutral sounds in the background. Relaxation techniques may also be recommended, and stress management. Tinnitus retraining therapy and neuromodulation, which can be provided by audiologists, and cognitive behavioral therapy. Let's focus on tinnitus retraining therapy and neuromodulation and explain these a little bit more. Tinnitus retraining therapy was developed by Paul Jastroboff in the 1990s. And this has been the gold standard for tinnitus treatment for quite some time. Tinnitus retraining therapy retrains the brain by targeting neuroplasticity so that one can habituate to the perception of tinnitus. So when we talk about neuroplasticity, our brain is always being modified by new things. This can be through experience, through education and learning. So part of tinnitus retraining therapy is directive counseling. This is an education-based counseling that targets that neuroplasticity to eliminate a strong connection between the limbic and autonomic nervous systems and our hearing system. And so we can habituate to the reaction. Additionally, we use sound enrichment. This is the use of on-ear sound generators. So a low-level sound is put into devices that are put on ear, similar to hearing aids. And this is used to divert attention from tinnitus perception, making it harder for the brain to focus on it. The final result of this is the annoyance factor is eliminated. And so we habituate to the perception. Tinnitus is no longer an issue because it is no longer on the mind. Time is very important when it comes to habituation, and it can take anywhere from 6 months to a year. Neuromodulation, or linear, is a treatment that can be used additionally to treat tinnitus as well. This is a newer treatment that is recently FDA approved. And what this is targeting is twofold. Neuromodulation is a treatment that can be used for a variety of conditions, such for pain, for example, by alternating nerve activity using low levels of electric energy, which then adjusts activity within the body or brain to improve a health condition. And so this has been adjusted and emerged as a treatment for managing tinnitus. With linear, like we said, this is a twofold stimulation. Auditory stimulation with the use of wireless headphones that will deliver sound therapy, as well as a somatosensory stimulation, which is the use of low-level electrical stimulation with the use of a tongue tip. So two nerves are being stimulated at the same time. Linear has been shown to be effective and safe in clinical trials for more than about 600 patients, and it is FDA approved. And the final result is similar to TRT, habituation to perception, where tinnitus is no longer an issue and no longer on the mind. CHC's Tinnitus and Hyperacusis Center was established in 1997 under the leadership of Susan Adams. We provide an array of treatments and tools for tinnitus and hyperacusis management. This does include TRT as well as linear. We offer in-office and remote services, and referrals in your area can be provided upon request. To address your tinnitus needs, please contact us. The information is here, and we will also share it at the end of the webinar today. Okay.
So
I think
thank
we
you.
have questions.
Thank you, Dr. Callandrillo. So we will open up for some questions. We did ask for some questions to be submitted ahead of time, and some of you did. And then there are also some questions now in the Q&A. Please remember, if you have any other questions, to put them into the Q&A, and we will happily answer them. One question that was already in the Q&A was about if linear is available in Canada. I actually think I am not sure if it's available yet in Canada. Dr. Callandrillo, do you know?
I'm not sure.
Yeah, I know it's relatively new, and so I'm not sure if it's available in Canada at this time. But we can find out that information and get back to you on that. So one question that was submitted ahead of time is, can tinnitus be cured or reversed? What happened that caused it to suddenly happen or get worse?
Yeah. So tinnitus cannot be cured, meaning that it's not something that we can get rid of completely. There's no pill or medication that has been clinically proven in majority of cases to completely take it away. And so this is why the main focus or goal is taking away the negative connotation and the negative reaction to it. Tinnitus may occur suddenly from significant noise exposure, for example, a life event, increase in stress, or maybe a new diagnosed hearing loss. So it can occur gradually as well as suddenly. Having medical follow-up will definitely ensure there's no medical reason to explain a new presence of tinnitus. But regardless, the main focus is on that habituation.
So we have another question, which actually is similar to a question that was submitted tonight. So the question tonight was, is headphone use increasing tinnitus in young people, and does exposure to loud sounds create tinnitus? And then what are the best earplugs in order to still enjoy many excruciating loud but wonderful music events?
All good questions. So let's start with the use of earplugs in general. So earplugs are definitely recommended for those loud noise exposure situations. So concerts, recreational shooting, anything where you are in a loud space. Earplugs are not recommended when there is tinnitus if you are in a quiet situation or an everyday situation, because we want to keep your ears nice and open to the environment. This is part of that sound enrichment that we were talking about. And so if we are completely blocking the ears for the majority of the day, then we're reducing that sound that the brain is getting. So yes, using earplugs is important in noisy situations. There are non-custom plug options. Some brands are Eargasm and Loops. There are also custom options which can improve the fit and level of noise reduction. Those custom plugs require a custom piece that's made for you. So an impression is taken of your ear, and then a filter is put into the earplugs so that you have an appropriate level of attenuation of noise without compromising the sound of the performer or whatever experience that you may be having. So we do offer those custom noise plugs at CHC. And we offer verification of them to ensure that the level of noise reduction is met. What else about noise plugs? We don't recommend earplugs for sleeping. So if you have tinnitus, I highly recommend that you do not use earplugs to sleep because, again, that sound enrichment is really important.
So another question that we received is, what are ways to address tinnitus at night?
Good question. When you have tinnitus, quiet places are not your friend. And so nighttime is usually a time where things are winding down, it's quiet. And so in those situations, you want to use some sound in the background. As we said, we want this to be a pleasant sound or a neutral sound. So this could even be just the presence of turning on a fan in the background. White noise, there are apps that have different types of sounds or alarm clocks that maybe play different sounds like rain or waves. But you want it to be something that you either enjoy listening to or something that's neutral.
So this is a question that was submitted earlier and then similar to two that are here in the chat. One is, when I often walk, my tinnitus changes in volume. Why would this keep changing? And then someone also said they had 2 times where the tinnitus got really loud for a few months and then went back to normal. And then someone asked, why does it get louder?
Okay.
So I guess we're all pretty much experiencing fluctuations in tinnitus. And can you explain why?
So similar to the poll that we did, where tinnitus can be different in quality, right? It can also be different in volume or fluctuate in volume. And all of these fluctuations are normal. There may be some good days and there may be some bad days. There may even be days where the tinnitus fluctuates throughout that day. And so some reasons for this can be fatigue, for example. So if you didn't sleep well the night before, or you're not a good sleeper, so fatigue can have an impact on increasing that perception. Stress as well. So, if the workday was long, work days, maybe tinnitus might be more noticeable during the week compared to the weekend where you may be a little bit more relaxed. And then again, tinnitus is typically perceived in quiet, which is why we say to limit your quiet hours. So it may be more noticeable when you're going to sleep at night or when you're reading a book, versus when you're with a group of friends or out at a restaurant, for example. But regardless, what I do recommend is that you use as much sound enrichment as you can.
And so a couple of people are talking about using sound machines and they feel like the tinnitus is battling with the white noise, or should you use white noise even if you don't have tinnitus? I think Dominique stressed earlier you want to find a sound that works for you. So can you talk a little bit about that?
Right. Yeah. So the importance of the sound enrichment is that, again, that sound is either a positive sound or a neutral sound. The reason for that is, for example, if you don't like listening to the sound of the air conditioner, then that's going to become a bothersome sound if you have that on in the background all day. So it's really important that you find a sound that you like listening to. It doesn't have to be white noise. It can be classical music, for example. In terms of sound enrichment and the volume of the sound, we don't necessarily want to use sound to mask tinnitus. So the sound that you have on in the background does not have to be extremely loud. It can be a normal conversational level, because the brain can't learn to ignore the tinnitus if it can't hear it. So you don't want that sound, that background sound, to be extremely loud.
So there's been a couple of questions about what to avoid or what can exacerbate tinnitus. Some were asking about like use of Tylenol or medications, caffeine. Somebody also asked about increasing salt intake. And I know we talked a little bit about that in the presentation, but if you can just kind of, or even having a sinus infection or ear infection, can that do it? So can you just touch upon that a little bit?
Yeah. So ear infection, sinus infection, any buildup of like pressure within the ears can increase tinnitus perception. I see somebody in the Q&A wrote eustachian tube dysfunction. Yes. In terms of substance use, so caffeine, NSAIDs or aspirin, for example, all of those, there is potential to increase the perception of tinnitus. Alcohol causes dehydration and it increases blood pressure, while caffeine will stimulate the nervous system and alter blood flow. All of these substances really do have to be used in excess or on a daily basis in order to really have a significant effect on that perception.
And then so because we do know that loud sounds can affect tinnitus, and you can have tinnitus after exposure to loud sounds. It's one of the reasons why hearing protection is suggested, and that was a question that was asked as well. And we discussed types of hearing protection. Another question that was really asked was, does it matter how long you've had tinnitus for the treatment? And will that change how effective the treatment is?
That's a great question. No, it does not matter how your tinnitus came to be, what it sounds like, how loud it is, if and how long you've had it for. That will not change the effectiveness of the treatment.
I also want to there's been a few questions just about like if tinnitus is pulsatile, or you might feel like there's the sounds coming from your brains, not necessarily your ears. As Dominique mentioned in the presentation, it's always important to have an actual physician be able to review your symptoms and review what other symptoms you may be having as well, because you do want to always rule out any organic cause. And do you want to talk further about that?
Yeah. So a pulsing tinnitus or pulsatile tinnitus, the reason why it's important for medical workup in that case is because typically there's a relationship between that hearing a pulsing in your ear and a vascular relationship with the body. So this could be cardiovascular, it could be blood flow within the ear. And so that's why any type of tinnitus perception or new tinnitus perception, it's important to have both an audiologic and a medical workup.
So what are the long-term consequences of tinnitus? And second to that, we've had a couple of people ask if this is the first sign of Alzheimer's.
Okay. So let's answer the first one. What are the long-term consequences? So for many, tinnitus is a non-issue. But if tinnitus is bothersome, or if there's decreased sound tolerance that is bothersome, that's when it can really have an effect on quality of life, creating social isolation, increased annoyance, increased frustration. And so, this may cause some irritability, some anxiousness. And so we want to deal with that. Some with bothersome tinnitus may notice over time that their tinnitus improves without any additional treatment. And that's what we would consider to be a natural habituation. That can happen. The more you know about tinnitus and it's demystified, the easier it can be to learn how to manage it. So if you feel that quality of life is being affected, that's when participating in a program such as tinnitus retraining therapy program, neuromodulation, is going to be beneficial in helping to manage and reduce some of those long-term effects. But the actual presence or having tinnitus there is not necessarily causing any damage. So,
oh, sorry.
sorry, I wanted to answer the second one about Alzheimer's. So there's no correlation with tinnitus causing Alzheimer's. We know that tinnitus and hearing loss increases together sometimes. And so really it's hearing loss that is the risk of cognitive decline, but not tinnitus by itself.
So it was mentioned that there are social emotional supports at CHC. We do. We have psychiatrists, psychologists, and social workers, all who are also fluent in ASL. And they want to know, can you please share more about what that looks like? Because the emotional side of hearing loss and tinnitus are not generally mentioned.
Yeah, that's a really good point. So anyone who is part of our tinnitus program, anything that comes up that may be a relationship to emotional health and wellness, if a referral is needed, both me and our emotional health and wellness department will work together. So sometimes the clients will be seen in both departments.
And are tinnitus treatments covered by Medicare, and is linear covered by insurance?
Unfortunately, anything that has to do with tinnitus is not covered by insurance. So that includes tinnitus retraining therapy, linear. It's not covered. Medicare will cover a hearing test. So that is a great first step. And then I wouldn't, the fact that it's not covered by insurance, I wouldn't stray that away from contacting us and just starting with a hearing test or getting more information to figure out what might be a good way to manage your symptoms.
And also remember, like Dominique said, often hearing loss goes along with tinnitus. And so it's good to know that insurances can cover hearing aids, which may be helpful for tinnitus, and sometimes secondary insurances to Medicare can also cover that. So then, can you discuss a little bit musical tinnitus? My tinnitus roars and plays almost musical notes and hisses.
Yeah. Musical tinnitus is a less common phenomenon, but it can occur. And this is when the perception of music or music-like sounds or tones are heard when there's actually no external source playing that music. The treatment remains exactly the same as compared to all of the other forms of tinnitus. So all of the sound management and tinnitus programs are an option in that case as well.
And then there's a question about, are there treatment options for those who develop tinnitus after cochlear implant surgery?
Great question. Sometimes this is a complex question because there is mixed results as to if you get a cochlear implant depending on when that onset of profound hearing loss occurred, depending on when that implantation occurred, sometimes the implant alone can reduce the perception of tinnitus. If it doesn't, there are parts of tinnitus retraining therapy can help. We can't use an on-ear sound generator in the case of a cochlear implant, but there are other educational factors to talk about, as well as, there's the cognitive behavioral therapy, still sound enrichment with the implant and training the implant and things like that.
I mean, it's important to also talk with your implant team because there are some people who have reported improvement.
Mm-hmm.
So I know one of the questions that we got as well was how many people suffer from tinnitus due to the use of hearing aids? Like hearing aids causing the tinnitus.
Yeah. So there's no evidence that hearing aids would cause tinnitus. Like we said, hearing loss and tinnitus can go hand in hand. So just the nature of hearing loss can create that perception of tinnitus, but there's no relationship between hearing aids causing tinnitus.
And then also, so you know about how long linear usually takes to create habituation?
So linear is some clinics are doing like a 12-week use. It is supposed to be less time in terms of using the device as compared to on-ear sound generators. But that habituation process, regardless of what type of device you use, time is really, really important. And so I don't like to put a timestamp on habituation and reaching habituation because it can be an unrealistic expectation. And so habituation takes time. I know that's hard, but that is why we have a pretty extensive and lengthy program to work with our clients in order to work through that habituation process. So I don't have a set answer on a set time because there really isn't one.
We do know that recent studies have shown that if you work alongside treatment with an audiologist, linear is more effective than if you're doing it on your own. So it is always important to discuss it with an audiologist. So we have two questions. One, they're similar, so I'm going to just stick them together. Can tinnitus cause dizziness? And the other question was, I'm a veteran who has tinnitus and experiences vertigo. What should I do?
So tinnitus is not necessarily causing the dizziness. There are certain types of hearing loss and other issues that can cause tinnitus as well as dizziness. So it can be something that goes together. Meniere's disease, for example, is one type of hearing loss that has both tinnitus and vestibular symptoms. Migraines, for example, sometimes can also create both tinnitus and vestibular problems. But there's no direct connection between the two. But that's why it's important to work with both audiology and ENT. Imaging may be recommended in order to determine if there's any structural reason for these issues. And audiologists are also skilled in diagnosing vestibular conditions. And sometimes in that case, vestibular therapy can help as well.
I will add that if you experience sudden tinnitus and sudden vertigo, you really should seek medical attention as quickly as possible because you can be experiencing a virus in the inner ear, and there are immediate treatments that may be able to help with that. So if you've never experienced it before and suddenly you are, seek treatment. So this, I'm going to ask for as short an answer as possible given the time constraints we're in, but someone was asking a little bit about misophonia and the connection to tinnitus, and if you could briefly explain that.
Yeah. So tinnitus can be present with misophonia. Misophonia can be present by itself. And so there is just because you have one doesn't mean you have the other. But misophonia, again, is that sensitivity to very specific sounds coming from something or someone. And treatment can be relatively the same. Tinnitus retraining therapy can also be helpful for misophonia.
And does ocular migraines have any correlation to tinnitus?
Migraines have a correlation to tinnitus, so I would say ocular migraines would go underneath that as well. Yeah.
Yeah, if there's a correlation, it can exist together, but doesn't necessarily have to.
Right.
And so we have one final question I think we're going to get to, if you can, in the short amount of time we have. Does endolymphatic high drops cause tinnitus?
Endolymphatic high drops, or Meniere's, can have a relationship with tinnitus, yes.
Yeah. It's often a sign as well.
Correct.
For the audiologist, it's a flag if you have a specific type of tinnitus that could be. So we are almost out of time. I would like to thank Dr. Callandrillo and thank you for joining us tonight. This was a lot of information regarding tinnitus and tinnitus treatment, as well as hyperacusis and misophonia. And I want you to know that CHC is here for you to reach out to. We are happy to answer any questions or be available to schedule any appointments. In our chat, we have our contact information. We've also included a survey. If you could please fill that out, we would truly appreciate it. I'd like to thank our interpreters, Jamie Steinberg and Barbara Finkst, and our captioner, Trisha Aldrich. I find it very helpful for me to have captioning, so I'm sure all of you did as well. And again, if there are questions, we're here to answer them. If you have any comments, we would welcome those as well. And the information to contact us and the survey is in our chat. Thank you again, Dr. Callandrillo.